Thank you for joining us here on the NPTE Final Frontier podcast. My name is Dr. Emily Gerby.
And my name is Dr. David Friedberg. Today we're simplifying a topic that shows up very often, but it can be very overwhelming as well. This is cranial nerve testing. All right, so to start you off, I'm going to hit you with a question. Here we go. During an examination, a patient demonstrates an inability to abduct the right eye past midline. Which cranial nerve is most likely affected? Is it option A, cranial nerve 3, the ocular motor? Option B, cranial nerve 4, trochlear? Option C, cranial nerve 6, abducens? Or is it option D, cranial nerve 5, trigeminal?
All right, so let's break down each of these option choices, starting with option A, which was our cranial nerve 3, also referred to as our ocular motor nerve. Now, this controls majority of our eye movements, including medial, upward, and downward gaze. So remember, medial, upward, and downward gaze, as well as eyelid elevation and pupil constriction. A lesion here causes things like ptosis and lateral deviations, but not necessarily isolated abduction loss. So at this point, we can cross off option A. Next up, we have option B, our cranial nerve 4 or trochlear nerve. This nerve controls the superior oblique muscle. This muscle helps to move the eye downward and inward. So again, our trochlear nerve moves our eye downward and inward. Injury here leads to difficulty looking down while adducted or adducted, often causing diplopia when reading, but not abduction weakness. So again, we can cross off option B. Next up, we have option C, our cranial nerve 6, or abducens nerve. Now, this nerve controls the lateral rectus muscle, responsible for what? For eye abduction, just like in the name, the abducens nerve. So, if the patient can't move their eye outward, this nerve is what would be affected, meaning that option C, our cranial nerve 6 or our abducens nerve, is the correct answer here, is because that is what would the limitation would be. And finally, we had option D, which was cranial nerve 5 or our trigeminal nerve. This nerve is primarily the sensory component to the face and motor to the muscles of mastication, unrelated to eye movement specifically. So that's why we can cross off option D. Great job, Warriors.
All right, now to review ocular motor, trochlear, and abducens nerves. Coordination of the eye movement. Let's review it. If you can't move the eye outward, what is it going to be? Cranial nerve 6. All right. If you can't look down and in, what is it going to be? Cranial nerve 4. If you can't move it up, down, or in, that's right, it's going to be cranial nerve 3.
All right, now on the NPTE, make sure you read the direction of movement described in the question. It always points you straight to the correct cranial nerve, just like David reviewed with you.
Now that you heard this episode of the podcast, here is a quote from the Dalai Lama. Happiness is not something ready-made. It comes from your own actions. So continue to do whatever makes you happy, but also balance is the key. So keep your focus on your exam, your goals, and your dreams. You are powerful. You are strong. You are a Final Frontier warrior. You will pass.
Thank you very much for listening. For more information on Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, TikTok, and X.
Till next time, have a great day and a powerful tomorrow.